In combined injuries of the anterior cruciate ligament, or ACL, and medial collateral ligament, or MCL, the knee often becomes unstable, and that added looseness can place damaging stress on an ACL graft, increasing the risk of failure. To explore how different surgical techniques could reduce this strain, Dr. Peter Behrendt and colleagues from the University of Munster, Germany, conducted an in vitro biomechanical study using 8 cadaveric knees. The researchers simulated injuries to both the superficial and deep MCL, then compared 4 reconstruction methods: the modified Lind reconstruction, a single bundle superficial MCL with anteromedial reconstruction, a flat superficial MCL with flat anteromedial reconstruction, and an isolated single bundle superficial MCL reconstruction. When both MCL layers were sectioned, ACL load rose sharply, nearly 88% higher at 90% of knee flexion. However, reconstructions that involved an anteromedial graft, designed to mimic the stabilizing role of the deep MCL, effectively reduced that excess load and restored forces close to those of a healthy knee. The isolated superficial MCL reconstruction, in contrast, was less powerful to achieve a meaningful reduction. Among the techniques tested, reconstructions combining superficial MCL and anteromedial grafts, particularly the modified Lind technique, most effectively restored the knee's native load profile. These findings suggest that addressing the anteromedial structure during combined ACL and MCL surgery may help protect the graft and improve long-term knee stability.